Good morning, everyone. This is USMLE video lectures. I hope every one of you doing well, preparing well for your exam. Today, I would like to discuss Osgood Schlatter disease. This is a very common disorder in teens. And repetitively using your knee joint or even trauma can lead to inflammation in the tibial tuberosity and can cause this disorder. Let us do a question. A 13-year-old boy who plays soccer 5 times a week presents with progressive anterior knee pain for the past 2 months. The pain worsens during running and jumping but improves with rest. Physical examination reveals tenderness and swelling over the tibial tuberosity. There is no effusion or instability. Which of the following is the most likely diagnosis? A. Patellar tendonitis. B. Osgood Schlatter disease. C. Anterior cruciate ligament ACL tear. D. Juvenile idiopathic arthritis. E. Slipped capital femoral epiphysis. So, this is the classic presentation of Osgood Schlatter disease. A 13-year-old boy playing soccer 5 times a week, presenting with progressive anterior knee pain for the past 2 months. And the pain worsens during running and jumping, but improves with rest. And in the physical examination, you found tenderness and swelling over the tibial tuberosity. So whenever you see that word, tibial tuberosity, you should think about Osgood Schlatter disease. Now, Osgood Schlatter disease is a traction epiphysitis of tibial tuberosity, common in adolescent athletes due to repetitive quadriceps contraction. The best way to remember this is to imagine a soccer player. Imagine a soccer player hitting the ball, okay? And then write 15 on her shirt. So that makes you to remember that this is a disease common in adolescents. And around the knee, put a red circle. Around the tibial tuberosity, okay, you put an arrow up the quadriceps tendon. So that makes you to remember that basically quadriceps tendon is pulling over the tibial tuberosity. That makes you to remember the pathogenesis of this disorder. Then when it comes to treatment, imagine a coach. The coach is saying, stop, go home, take ibuprofen, take rest, and go for physical therapy. So that is the treatment. So use these visual memory aids. That is the best way to memorize these important disorders. Then I also made up a mnemonic, Osgood pain. In Osgood pain, O is for overuse injury in overactive teens. S is for sports-related injury. You can also say sore bump at the tibial tuberosity. G is for growing adolescents. O is for ossification at tibial tuberosity. And then another O is overlying pain and swelling. And the D is diagnosis is clinical. I mean, many times they said tibial tuberosity is showing fragmentation on X-ray, but you don't need X-ray to diagnose this disorder. Then P is for prominent tibial tuberosity. A is activity modification. That is the first line treatment, activity modification. I is for ibuprofen or NSAIDs, and N is for no surgery. Coming to incorrect answers, if you see A, patellar tendonitis typically affects older athletes and presents with point tenderness at the inferior patellar pole, not the tibial tubercle. Patellar tendonitis is pain over inferior patellar pole, not the tibial tubercle. Then anterior cruciate ligament tear. It comes from usually from a twisting injury to the knee. They present with knee instability, which is not seen in Osgood Schlatter disease. And also in anterior cruciate ligament tear, you don't find any tibial tuberosity tenderness. Then juvenile idiopathic arthritis, more likely to cause morning stiffness, joint swelling, and multiple joint involvement. Then slipped capital femoral epiphysis, it presents with hip pain or knee pain, limited range of motion, and antalgic gait. It is not associated with tibial tuberosity tenderness. So the super point here is Osgood Schlatter disease is a traction apophysitis of the tibial tuberosity, common in adolescent athletes presenting with anterior knee pain that worsens with activity and tenderness for the tibial tubercle. Super formula. What in the world is super formula? Super formula is identifying a disorder based on its unique characteristics. That is super formula. The super formula here is adolescent athlete presents with knee pain plus tibial tuberosity pain plus worse with activity plus better with rest plus fragmentation on X-ray if needed is equal to Osgood Schlatter disease. So any adolescent presenting with knee pain plus tibial tuberosity tenderness is equals to Osgood Schlatter disease. That is the super formula. Remember these super formulas, because if you see these characteristic features in the question, you can arrive at the diagnosis within a few seconds. All right, folks, that's all about Osgood Schlatter disease. Use these questions as you prepare for your exam. On our website supertestscores.com, we have a complete Q bank, 2,000 questions, like written by board certified physicians like myself. They are all for you just for $10. Okay, don't waste your money buying expensive courses on the internet. Buy this $10 question bank, 2,000 questions. You can finish in 3 months and get a top score in USMLE and or NEET and land in a residency of your dreams. Okay, please visit supertestscores.com. You can either subscribe to the 2,000 questions Q bank, or you can also use the free Q bank. In the free Q bank, you will get 300 questions, all for free. All right, folks, that's all about today, and I will see you in the next episode. Thank you.